Hello, my name is Dr. Amey Sonavane and I'm a consultant gastroenterologist and hepatologist at Apollo Hospitals, Navi, Mumbai. Today we'll be looking at certain lifestyle modifications or certain guidelines for the home care of patients with chronic liver disease. Now let us start with what diet should these patients consume. They should consume a variety of healthy foodstuffs, which includes carbohydrates, proteins and fats. They should avoid roadside food and water and unsafe drinking water because it can give rise to hepatitis A or E, which can affect the liver further. The fluid intake is as per what a gastroenterologist or a hepatologist prescribes, but usually fluid should be restricted when the serum sodium level is less than 125. Patients with chronic liver disease are advised for a pre-bed snack, and pre-bed snacks could include rice with custard, puddings, any fruit smoothie, rasgullas or gulab jamuns. Now, patients are advised, especially those with diabetes, to ensure that their blood sugar levels do not go haywire with these pre-bed snacks. Pre-bed snacks should be consumed after the meal, that is the dinner, and just before sleeping, around 15 to 20 minutes. All those patients with chronic liver disease are advised to have a salt-restricted diet, and the salt restriction should be less than 4 grams a day. They should avoid salts in any form, even light salt, black salt, sea salt has equivalent of the same amount of salt. So please do not fall for those gimmicks. Instead of salt, they can try salt replacement in the form of pepper, lemon juice, herbs, garlic, curry leaves, onion or spices. There are certain foodstuffs which have a lot of salt and you should avoid those, which includes biscuits, noodles, pastas, pickles, canned foods, cheese, butter, shellfish, etc. Also, patients with chronic liver disease are advised not to consume alcohol, not to smoke, or not to chew tobacco. There are certain medications that all these patients with chronic liver disease consume, and they are advised to follow up with their gastroenterologist or the consulting hepatologist for changes in any of these medications. They should not consume any over-the-counter drugs or any herbal preparations which can further affect their liver. Also, care should be taken that they should not consume sleeping pills which can precipitate hepatic encephalopathy. If they are having pain, the safe level to take paracetamol is less than 2 grams a day. Patients with chronic liver disease are also advised to follow up regularly with the gastroenterologist or the hepatologist. They are advised to screen regularly for any liver cancer, and the screening should be done every 6 months, and it should comprise of an alpha-fetoprotein blood test as well as an ultrasound. Also, patients with chronic liver disease are advised to undergo an upper GI endoscopy to screen for esophageal or fundic varices. They should do a creatinine level before any CT scan procedure is done, just to ensure that the creatinine levels are normal before proceeding for the scan. They should also monitor the creatinine electrolyte levels, especially when they are taking pills which are called as diuretics, which reduce the water in the tummy and which helps the water to be mobilized through the urine. Patients with chronic liver disease are also advised to avoid constipation, because if they get constipated, that can precipitate hepatic encephalopathy. So they should ensure that they should have at least 2 to 3 stools per day and consume lactulose for the same. Also, patients with chronic liver disease are advised to exercise regularly, and the exercise regimen should consist of a warming up, aerobic as well as resistance training, and a cool down exercise. That improves flexibility. Also, they advise that if they can do some yoga or stretching exercises, it will be beneficial. There are certain conditions when patients with chronic liver disease should immediately see their doctor, which includes fever, extreme fatigability, passing black colored stools or melena, vomiting out blood or coffee brown colored material which could indicate GI bleed, increasing jaundice, pain in the abdomen, any distension of the abdomen, any drowsiness, dizziness, or any bleeding from any side. If they have any rash over the body or redness over the hands and the legs, they should again immediately see the doctor. So by taking all these precautions, patients with chronic liver disease can have a better life. Thank you.